David Cunningham. I'm a family physician, been practicing for 20 years. I have a practice, Infinity Health and Body, that focuses on helping people live better longer. We do regenerative medicine, some lifestyle medicine, concierge primary care, and aesthetics, along with a heavy focus on sexual health and wellness. South of Boston, between Boston and Providence. Been here for my entire career in some way, shape, or form in the south of Boston area, and started practicing sexual wellness formally about 5 years ago as part of the Gainswave network. I'm now the national clinical advisor for Gainswave and FemiWave, helping to develop new protocols and teach physicians throughout the States and Canada incorporate this into their practice. And as part of that, I was lucky to meet Dawn as part of my journey through sexual health and wellness. And she's helped me incorporate the products that we're going to be talking about today. So the carboxy gel therapies as part of the synergy with sexual health and wellness. It's interesting. We're going to talk about, the specific treatments, individual treatments, and the combination of those. And what I've noticed over the years that I've been doing this is an increasing trend towards synergistic approaches. So multimodal approaches where you're combining potentially modalities in the office as well as therapies that patients might be doing at home. For men, that might incorporate the D5 inhibitors, sildenafil, things along those lines, along with the gels, the carboxy gels that we've been applying both in the office and giving patients to take afterwards. And then we combine that with the modalities like Shockwave and, E-shots, O-shots, things along those lines. So we'll talk a little bit about how to put those things together where everything has evidence, everything has a basis for success. And then the more you put it together, the more opportunities you have for successful treatment.
Love it. Love it. And so you started off as in primary care, you said, right?
Yeah.
What made you kind of choose to go down this path then?
Yeah, so it was an interesting circuitous route. I'm a primary care physician by training. I've always had an interest in men's health and musculoskeletal medicine. And about 8 years old, next month will be 8 years, I started a primary care practice based on a concierge direct primary care model, and getting out of sort of corporate medicine where it's 7 to 10 minutes per visit. I was able to really start to focus with my patients on root cause analysis, really sort of focusing on what is underlying disease, illness, and starting to move upstream. And as part of that journey, a few patients of mine mentioned that they had done a sexual health treatment at the time, a Shockwave treatment. And that led me to look into the Gainswave network, became a Gainswave physician, and that just catapulted my entire practice in a whole new direction in terms of regenerative medicine, really looking at ways that we can stimulate healthy change within the body using evidence-based, safe, effective, and well-tolerated treatments. And again, some of those are in the office. Some of those are outside the office, in terms of like the carboxy gels we'll talk about. And that really has changed my entire practice. So probably about 40 to 50% of what I do now is based on regenerative medicine, sexual health, even with the aesthetics that we do in the practice. We're using a lot of the products that we'll talk about tonight.
That's so interesting. So you kind of went the sexual health route first and then kind of forayed into aesthetics.
Mm-hmm. Yeah, absolutely. So it's sort of, the use of sexual health, or the approach for sexual health in terms of regenerative medicine has applications for so many different things. And what I was finding is that patients would come in for things that they wanted, i.e., better erectile function or better, assistance with female sexual dysfunction, but then they would stay for things that they needed in terms of lifestyle medicine, really kind of diving into why they ended up with sexual health issues in the first place. Why does somebody in their 40s or 50s start to develop erectile dysfunction? We start to talk about endothelial dysfunction. We start to talk about metabolic syndromes, and all of that leads into a deeper dive into lifestyle medicine and overall health and metabolic health or cardiometabolic health. And interestingly, as we start to talk about those things, people start to feel better about themselves and want to look better. And so, then it almost naturally leads into the world of aesthetics, weight loss, body sculpting, cellulite treatment, muscle development, all the things that go along in that realm, in addition to facial aesthetics. And we do TICSEL, we do acoustic wave therapy for facial rejuvenation, and all of those things can be enhanced by the products that we're talking about.
I love it. I love it. And where do you feel like you've seen sexual health as a whole previously, and where do you feel like the trends are going now and kind of in the near future?
Yeah, so I think when I started doing it, this was again back in 2018, the rest of the world was already way ahead of us in terms of the use of medical shockwave radial pressure treatments for erectile dysfunction. And now, fortunately, we're also seeing that in terms of female sexual dysfunction. It's always been, about ED, and now we're seeing a greater, that's one of the trends right off the bat, is that we're seeing a greater focus on female sexual dysfunction, which is, it's complex. It's urinary incontinence, it's dyspareunia, it's provoked vulvodynia. There are a lot of things that are going on that lead into dysfunctional female sexual experiences. It maybe, I don't want to say more complicated, but just different than erectile dysfunction. So that's one trend. And then the other thing I've really noticed is that, again, probably all of us remember when Viagra first came out and how groundbreaking and what a paradigm shift that was to have something that actually worked for men for sexual dysfunction, and led to a lot of other stressful situations, potentially in relationships that were otherwise stable, on sexual relationships that were stable. But regardless, it was great to have some solutions or a solution. But what we've realized is that it only addresses one small part of the problem. And now we're recognizing, particularly with erectile dysfunction, the role of endothelial dysfunction, the role of metabolic syndrome, neurologic conditions, and the role of overall health in terms of why people got to my office to treat their ED in the first place. So with that comes a different approach, and it's got to be much more of a multimodal synergistic approach. So radial pressure is different from focused shockwave. They treat slightly differently. So sometimes we combine those two. Sometimes we're combining them with hormone optimization. Oftentimes we're combining them with CO2 lift, the CO2 Pro, and we're seeing that by treating from a carboxy gel standpoint, improved vascular oxygenation, we're getting improvements right off the bat in terms of elasticity, in terms of endothelial function, and we're giving people a boost right off the bat in terms of the nitric oxide delivery. So all of those things combined improves patients' overall results and their sort of buy-in, so to speak. In the world of regenerative medicine, just really quickly, sometimes the results are slow. So one of the things that we struggle with is, you're going to do these treatments, maybe it's over 3 weeks or maybe it's over 6 weeks. You may not see those full effects for 12 weeks, even further out. We're setting off a process of regenerative change that may take some time. What's exciting about the CO2 lift is that you can often see effects and improvements right, within a couple of days, within a week. Some of the treatments we'll see later on, even one treatment makes a significant difference. So by getting that buy-in early on, you bring patients back, they get encouraged. We always have to remember that so much of this is mental and emotionally attached, or mentally and emotionally charged. So really important to be thinking about that. It's really difficult to tell somebody that wants to feel younger, feel more vibrant, feel more sexual, that they will later. Yeah. They will. Let's check your calendar for March or June, Men's Health Month. We're going to start now so that you're able to be sexually active. It's really a challenging conversation. So if you have something that's going to help them right off the bat, like the CO2 lift products, it is definitely a game changer in terms of that conversation.